Things like coughing. This respiratory muscle strength decreases with age, can impair effective coughing, which is important for airway clearance. Nerves in your airways that trigger coughing also become less sensitive. Your VO2 max will decrease from 30 years old. Decrease in the lung tissue which means less blood is pushed around the body and less air being pushed in and out. Power breathing machines will make it harder to breathe in and out, making your respiratory system bones become thinner and change shape. This can change the shape of your rib cage. As a result, your rib cage cannot expand and contract as well during breathing. The muscles that support your breathing, the diaphragm, becomes weakened. This weakness may prevent you from breathing enough air in and out. These changes in your bones and muscles may lower the oxygen level in your body. Also, less carbon dioxide may remove from your body. Symptoms such as tiredness and shortness of breath can result change in the lungs. Change in lung tissue. Muscles and other tissues that are near your airways may lose their ability to keep the airways completely open. This causes the airways to close easily. Aging also causes the air sacs to lose their shape and become baggy. These changes in lung tissue can allow air to get trapped in your lungs. Too little oxygen may enter your blood vessels and less carbon dioxide may be removed. This makes it hard to breathe. Changes in the nervous system. The part of the CNS that controls breathing may lose some of its function. When this happens, your lungs are not able to get enough oxygen nor inhale enough carbon dioxide. Breathing may get more difficult. Nerves in your airways that trigger coughing become less sensitive. Large amounts of par- particles like smoke or germs may collect in the lungs and may be hard to cough up. Common problems. As a result of these changes, older people are at increased risk for lung infections such as bronchitis, shortness of breath, low oxygen levels, and abnormal breathing patterns. To decrease the effects of aging on lungs, do not smoke. Smoking harms the lungs and speeds up lung aging. Do regular physical exercise to improve lung function. Diaphragmatic breathing, deep breathing exercises that involve the intercostal muscles and diaphragm, which help maintain muscle mass in the respiratory system, making breathing more comfortable and efficient. Get up and move. Lying or sitting for long periods will allow mucus to collect in the lungs. This makes it difficult to cough and put you at risk of lung efficiency. Other factors. Metabolism. The basal metabolic rate decreases almost linearly with age. It is shown that the decrease in muscle mass relative to total body may be wholly responsible for the age-related decreases in basal metabolic rate. Due to metabolism decreasing, this means that your fat intake increases as your muscle mass decreases, which causes you to get fatter, making exercise feel more difficult. Thermoregulation. When you age, the sweat glands weaken, meaning there is delay in sweating due to the sweat glands not being able to process the information. This leads to a struggle to release heat efficiently. Weight may prevent training. In extreme environments, it can also increase the chances of hypothermia. Body composition is the percentage of fat there is in your body. As you age, there is a tendency to increase your level of body fat and the percentage of muscle mass decreases. This change in BMI means the exercise becomes harder as muscle strength is weaker, whereas body mass is higher. This will affect the person's motivation and perception of their ability to train. Here are some examples of aging athletes still able to compete at international levels in their sports. The World Masters Champions has competitors ranging between 80 and 89 years old. Dirk Nowitzki is still competing at the highest level at 40 years old in the NBA. With the improvements in healthcare, training programs, and diet, older athletes are able to continue to compete in events.